Welcome to today's session on coronary circulation, where we'll explore the arteries and veins that supply blood to the heart muscle. The heart, like every other organ, requires a continuous supply of oxygen and nutrients to function. This is achieved through the coronary circulation, which includes coronary arteries that deliver oxygenated blood and cardiac veins that drain deoxygenated blood. An efficient coronary circulation is vital for sustaining life. The coronary arteries arise from the base of the ascending aorta, just above the aortic valve. The right coronary artery supplies the right atrium, right ventricle, the sinoatrial node, the atrioventricular node, and part of the interventricular septum. The left coronary artery is larger and divides into two main branches. The left anterior descending artery, which supplies the anterior wall of the left ventricle and the interventricular septum, and the circumflex artery, which supplies the left atrium and the lateral and posterior walls of the left ventricle. Here is some detail about the branches of the right coronary artery. The right coronary artery gives off several important branches. The right marginal artery supplies the right ventricle. The posterior descending artery, also called the posterior interventricular artery, supplies the posterior interventricular septum and inferior wall of the heart. In most individuals, the right coronary artery also gives off the sinoatrial nodal artery, supplying the sinoatrial node, and the AV nodal artery, which supplies the atrioventricular node. Branches of the left coronary artery. The left coronary artery has two major branches. The left anterior descending artery gives off diagonal branches that supply the anterior surface of the left ventricle and septal branches that supply the anterior 2/3 of the interventricular septum. The circumflex artery runs around the left side of the heart and gives off obtuse marginal branches to the lateral wall of the left ventricle. In about 40% of cases, the circumflex also gives rise to the acinodal artery. Cardiac veins. Venous drainage of the heart is mainly through the coronary sinus, which empties into the right atrium. The great cardiac vein runs alongside the left anterior descending and drains the left ventricle and interventricular septum. The middle cardiac vein runs with the posterior descending artery, draining the posterior portion of the heart. The small cardiac vein runs with the right coronary artery, draining the right atrium and ventricles. Other veins include the anterior cardiac veins, which drain directly into the right atrium, and the Thebasian veins, which are tiny veins that empty directly into the heart chambers. Clinical significance. The coronary circulation is of great clinical importance. When coronary arteries become narrowed or blocked, it results in coronary artery disease, which may lead to angina or myocardial infarction. Variations in coronary anatomy may influence a person's susceptibility to ischemia. Fortunately, collateral circulation, that is, alternative blood flow pathways, can sometimes reduce the severity of damage during obstruction. Here is a flow chart illustrating major coronary arteries and their tributaries supplying different heart regions. This is an easy way to recap and revise coronary circulation. A deep understanding of coronary circulation is crucial for cardiology, surgery, and emergency medicine. Thanks for watching. Don't forget to like, share, and subscribe for more medical education videos.